Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on antihypertensive medications. So let us discuss what are these. Blood pressure. Now first we come to the blood pressure. Blood pressure is the force of blood pushing against the wall of the arteries as your heart pumps out blood into the arteries. It levels varies with age, sex, level of physical activity and emotional changes. Hypertension refers to the sustained elevation of blood pressure above normal range according to the World Health Organization. Hypertension is defined as systolic over diastolic pressure persistently higher than 140 over 90 mm of mercury. Risk factors for hypertension include increasing age, family history, overweight, and smoking. Sometimes high blood pressure may also be caused by certain medications or underlying diseases such as kidney or endocrine diseases. There is usually no obvious symptoms associated with hypertension, and many patients may have not be aware until they check their blood pressures or when complications develop. So it is a silent killer. Poorly controlled hypertension may lead to severe complications such as a stroke, coronary heart disease, aneurysms, or a balloon-like bulge in the artery, aorta, and kidney function impairment, etc. Treatment modality depends on the level of your blood pressure and your risk of developing cardiovascular diseases. If there are underlying conditions for your hypertension, your blood pressure will be controlled by removing the cause. Work with your doctor to devise the appropriate treatment plan. In general, lifestyle modifications such as having a healthier diet, exercising more regularly, quit smoking, and drinking less alcohol is good for your blood pressure. However, pharmacological treatment may be needed as well, especially when your blood pressure is much higher than normal or your risk of cardiovascular disease is high. Now we would come to the antihypertensive drugs. A variety of blood pressure lowering medicines, antihypertensive drug is available in the market. Your doctor will use the most appropriate drug or a combination of drugs after considering the risk and benefits. Good blood pressure control is important for preventing cardiovascular or cerebrovascular events. In most cases, your blood pressure needs to be monitored lifelong. Antihypertensive drugs may have some side effects, but these can often be resolved by adjusting the dosage or changing the type of drugs. Patients are advised to follow doctor's instructions in using the drugs and consult their doctor if they have any concerns or queries. In Hong Kong, antihypertensive drugs can only be obtained from pharmacy with a prescription. They should be used under close supervision by the healthcare professionals, and antihypertensive drugs are available in different dosage forms. They include oral, example tablets, and capsule form, and injectable, example intramuscular and intravenous injections. The most widely used medications for treating hypertension include ACE inhibitors, angiotensin-converting enzyme inhibitors. Angiotensin-converting enzyme inhibitors reduce blood pressure by relaxing your blood vessels. Example: enalapril, lisinopril, perindopril, furosemide, monopril, captopril, etc. And then is angiotensin 2 receptor blockers. Angiotensin 2 receptor blockers help relax your blood vessels, which lower your blood pressure and makes it easier for your heart to pump blood. Example: losartan, valsartan. And now we come to the calcium channel blockers. Calcium channel blockers keep calcium from entering the muscle cells of the heart and blood vessels. This widens your arteries or dilates and reduces your blood pressure. Example: diltiazem, nifedipine, amlodipine, nimodipine, calanasar, like these drugs. And then we have diuretics, sometimes known as water pills. Diuretics work by flushing the excess water and salt from the body through urine, such as amiloride, furosemide, indapamide, etc. And then we have beta blockers. Beta blockers work by making your heart beat more slowly and with less force, thereby reducing blood pressure. Example: atenolol, metoprolol, propranolol, nebivolol, etc. Then alpha blockers. Alpha blockers work by relaxing your blood vessels, making it much easier for blood flow to flow through them. Example: doxazosin, prazosin, etc. And then are the centrally acting antihypertensive drugs. Centrally acting antihypertensive drugs like methyl-dopa and clonidine acts by stimulation of alpha-2 adrenoreceptors in the central nervous system, and which results in reduction in the sympathetic tone and a fall in blood pressure. Methyl-dopa may be used for the management of hypertension in pregnancy as well. And now another type of drugs are vasodilators, which reduce the blood pressure by dilatation of the blood vessels. Example, hydrazine. So now I will tell you what are the most common side effects of ACE inhibitors. The most common side effects is the persistent dry cough. Other include dizziness, taste disturbance, and rashes. And the precautions are not suitable during pregnancy. The concomitant use of potassium supplements and potassium containing salt substitute is not recommended. Then angiotensin 2 receptor blockers. Side effects include dizziness and headache, and their precautions are not suitable during pregnancy. The concomitant use of potassium supplements and potassium containing salt substitute is not recommended. Then calcium channel blocker side effects include flushed face, headache, swollen ankles, constipation, dizziness, and tiredness. And the precautions include avoid drinking large quantities of grapefruit juice, high fiber diet, and drink plenty of fluids to reduce the side effects of constipation. And diuretics have the most common side effects: urinary frequency, dizziness, gastrointestinal disturbances. And the precautions are take the tablet in the morning, and hypokalemia can occur with some diuretics. Then is the beta blocker side effects include tiredness, cold hands and feet, slow heartbeat, diarrhea and nausea, sleep disturbances, nightmares. And precautions are may trigger asthmatic attack in patients with asthma or chronic bronchitis, and symptoms of hypoglycemia may be masked in diabetes patients when using the beta blockers. And then the side effects of alpha blockers are drowsiness, hypotension, notably postural hypotension, syncope, asthenia, dizziness, headache, and dry mouth. Precautions are take first dose at bedtime to avoid postural hypotension. Then centrally acting hypertensive drugs have the side effects which include headaches, dizziness, and dry mouth. And precautions are may cause drowsiness, so if affected, patient should not drive or operate machinery while using them, and do not drink alcohol because this may worsen the side effects. Then vasodilators have the side effects of headache, nausea, vomiting, and tachycardia. And precautions are that if you develop symptoms of arthritis or unexplained fever or tiredness, so you should avoid them, and you must talk with your doctor. The following general points should be borne in mind when taking antihypertensive drugs. Be familiar with the name and dosage of the drugs you are taking. Be cautious about their possible side effects. Take the drugs regularly as instructed by your doctor in order to have effective control of hypertension. Keep taking the same dosage of drugs even if your conditions improve, unless your doctor suggested you to change your antihypertensive regime. Do not stop medication without your doctor's instruction. Take your medicines at the same fixed time every day as far as possible. If you miss a dose, take it as soon as possible, unless it is almost time for the next scheduled dose. In that case, skip the missed dose and take the next dose as directed. Do not take double doses. The drug should not be taken with alcohol drinks to avoid dizziness or fainting. Some types of antihypertensive drugs can cause dizziness or drowsiness, usually when you first start taking your medicine or if your doctor changes your dose. If you do feel lightheaded or dizzy, you should not drive or operate machinery, and seek your doctor's advice if the symptoms persist. Make sure you have sufficient drug stocks for several days. Do not wait till the last minute to refill the prescription. Communication with your doctor. Antihypertensive medication should be used under medical supervision, and seek your doctor advice on the best treatment option. And different antihypertensive drugs may have different actions and side effects profiles. Your doctor will prescribe the most appropriate drugs for you after considering your condition and your response to the drug. Inform your doctor of the individual drugs and medical history, because other drugs may interact with your antihypertensive drugs and some diseases may warrant for special precautionary measures. Inform your doctor if you are pregnant, as some types of antihypertensive drugs like ACE inhibitors and angiotensin 2 receptor antagonists may affect fetus and should not be used during pregnancy. Inform your doctor if you are breastfeeding, as some types of antihypertensive drugs are distributed into the breast milk. Seek medical advice as soon as possible if you are experiencing any symptoms or side effects suspected to be related to antihypertensive drugs. Your doctor may review your type of medications. Have regular follow-ups as advised by your doctor, and discuss with your doctor how to monitor your blood pressure at home. Ask your doctor before taking any other medicines or health products, as they might affect the effect of your blood pressure medication. And don't control your blood pressure by self-medicating with health products according to the product claims. In fact, products claimed for stabilizing blood pressures have previously been found to be adulterated with antihypertensive drug ingredients. Drugs should be stored in a cool, dry place unless specified on the label. Medicine should not be stored in refrigerators. Furthermore, drugs should be kept properly in place and reachable by children to prevent accidental ingestion. So this was all about antihypertensive medication. I hope so that this video will be more informative for you, and if you have liked this video, then kindly don't forget to subscribe my channel and share this video with other individuals as well. And have a wonderful nice day. Thank you very much for listening to this video.